Hello everyone, I'm Dr. Aditya Sai. Welcome to our channel of the Shoulder and Knee Clinic, where we discuss about various issues pertaining to shoulder injuries, knee problems, and sports injuries. So, today we are going to talk about a procedure known as a high tibial osteotomy. So, what's a high tibial osteotomy? Where it's done? So, what we need to know is in some individuals, especially active individuals, there may be malalignment of the knee joint. So if you see the knee joint normally, axis called the mechanical axis, which is the weight bearing axis of the lower limb, should pass through the center of the knee joint, ankle and hip, so that the weight is equally distributed in both areas of the knee. In some individuals, as they age, there may be overload on one area of the knee joint, there may be cartilage wear, so the knee, rather than becoming straight, becomes bent like this. And this is the starting point for arthritis. Now, high tibial osteotomy is an option in young active individuals, typically below the age of 50. So, in a high tibial osteotomy, essentially, we correct the alignment of the knee. An osteotomy essentially means that we cut the bone, correct the alignment, and fix it with plates and screws. So this is not a new procedure. This has been there since past 30-40 years. But what has become new is advent of newer implants with which we can give you a faster recovery from the surgery. So who is a candidate? Essentially people who have wear and tear of cartilage localized to one area of the knee joint in association with meniscus injuries. So in those individuals, we can correct the leg alignment, we can repair the meniscus and give a pain-free lifestyle. So essentially it is done through a very small incision around 4 to 5 centimeters in size. We cut the bone and correct the alignment. Typically in a day or two you're discharged from the hospital. You can start weight bearing depending on if any other procedures are done in the knee. So let's say suppose we are repairing the meniscus or repairing the cartilage, then for the first 6 weeks you are allowed to weight bear with the help of a crutches or a walker. If the cartilage is fine, if there is no associated meniscus injury and we are purely doing it to correct the alignment of the leg, then immediate weight bearing also can be started with the help of newer implants. So these implants help us in getting a faster recovery and early return to mobility. High tibial osteotomy is also done in significant case of wear and tear of cartilage in the knee joint localized to one particular compartment. So it is a very good and safe alternative to a knee replacement surgery. Selected candidates who want to retain their mobility, who want to squat on the floor, who want to do jogging or running, they are good candidates for a knee replacement compared to a total knee replacement. Because post a knee replacement, which is an artificial joint at the end of the day, you are generally advised not to squat on the floor or to do jogging or running. With a high tibial osteotomy, you can even get back to playing sports or activities like running, and it gives quite a deal of mobility and pain-free lifestyle. High tibial osteotomy, essentially what we need to understand is it allows the mechanical axis of the knee to redistribute. So if there was overload of the knee joint here, we correct the alignment so that the weight bearing comes in the center or slightly on the normal area of the knee joint. A procedure designed to improve the longevity of your natural knee joint. So suppose a 40-year-old person has medial compartment wear and tear or cartilage injury. He is not a candidate for a knee replacement surgery, but he is a good candidate for a high tibial osteotomy because he can retain his natural knee joint and he can play sports and do all those activities. Whereas 55-year-old person who has significant wear and tear of cartilage in both areas of the knee joint is not a candidate for a high tibial osteotomy. High tibial osteotomy takes time to recover and for you to get back to sports, which is typically by 4 months post surgery, but it gives you a more long-lasting pain relief. Is it a procedure which will cure the arthritis? So the answer to that question is no, it's not a procedure that cures the arthritis. It prevents the rapid progression of arthritis. It redistributes the weight in the knee joint. So arthritis is a process of wear and tear of cartilage in the body. So it eventually happens to everybody. Somebody starts it early at 40 years of age and somebody starts it at 80. The point being that a 40-year-old person cannot undergo the same treatment as a 80-year-old person. A 40-year-old person needs to retain the mobility and the ability to play sports, run and do all those activities for recreation. Otherwise, you'll have lifestyle issues. So this is a procedure essentially designed to enhance the longevity of your knee joint. So these are the kind of videos we make. If you like our videos, do share and subscribe to our channel. Thank you.